A big welcome to everyone. Thank you for being very patient with us while we resolve some technical issues. So you're here today with the web series from UN Globe on Seen, Heard and Equipped on creating safe spaces and keeping well. A big welcome. Let me start off by saying during these uncertain and very difficult times, on behalf of the UN Globe Board, our coordinators, we hope that you and your loved ones are safe, well and healthy. Before I start, I'd like to start off by saying thank you to Kaleidoscope Trust, to Juan and Lady Phil, who have helped identify some of our panelists today, to the UN's SISMU, to Ogachaka as well, and also to IOM for providing the resources for today and hosting today's webinar. I'm Kachatan Sandhu, and some of you may know me as Nanu, and I'm honored to serve as the president of UN Globe alongside an amazing group of people, Gabe Skelter and Sonia Donnelly, Jen Rumbach, and Sophie Brown. Some of you may be new to UN Globe and may not know what UN Globe is. UN Globe is the interagency system-wide association representing LGBTIQ+ people or workers in the UN system. Founded in 1996, UN Globe was established in response to the need for better information and knowledge exchange about issues in the UN workplace, particularly amongst LGBTIQ+ people. Our goal is very, very simple. It's the inclusion, equity, and non-discrimination of LGBTIQ people in the UN system and its peacekeeping operations. Now, with COVID, the mental health issues of LGBTIQ+ individuals working in the UN system are being compounded and magnified. In particular, for those colleagues working in duty stations in countries that criminalise LGBTIQ people, and LGBTIQ people who are in isolation with homophobic, lesbophobic, biphobic or transphobic household members, or with an abusive or violent partner. Additionally, the mental health services and advice offered by our employers are not always tailored for LGBTIQ+ personnel of the UN, and therefore often fall short in meeting our needs. These are very uncertain and challenging times with the crisis, and they've necessitated a discussion about how we can better support our well-being together. So to support you, our members, UN Globe has organised these two webinars. The first one was last week on emotional and mental health and mental health well-being. And today we have another session on creating safe spaces and keeping well. Now, today's session is going to address COVID-19 related mental health by exploring safe spaces and attending to self-care. And issues raised include coping with anxiety, uncertainty, depression, intimate partner violence, homophobia, biphobia, and transphobia during quarantine. Let me start by welcoming our first panelist, who will first speak, and then I'll introduce our second set of panelists. Our first panelist today is Madhubhashini Kalahari-Hewich. I hope I pronounced that correctly. Kalahari is the Regional Stress Counselor for Asia Pacific and Russian-speaking countries, working in the Critical Incident Stress Management Unit of UNDSS. Kalahari is a clinical psychologist by profession and was a practicing clinician and an academic prior to joining the UN in 2001. Prior to joining UNDSS in 2014, Kalahari held the post of Chief of Staff Counseling Unit in UMIT and Human Rights Officer Training, Human Rights Unit in UNISMET in Timor-Leste. In her current position as Regional Staff Counsellor, Kalahari provides technical guidance supervision to over 50 counsellors in the region and travels regularly to high-risk missions. Kalahari has also served as a gender focal point in the UN in Timor-Leste and in the current gender focal point in SISMA. Okay, over to you, Kalahari.
Thank you, Nanu, for that introduction. Can you hear me well?
Yes, we can. Thank you.
Thank you very much, and thank you for the invite to be with your colleagues and my colleagues. And I would like to apologize at the outset if I do say something that is not applicable to the group. I must say that I have been a long UN worker, and I've had the pleasure of knowing many members of the LGBTQIQ plus community, and I am fully aware of the challenges that the community has been experiencing, and it is time that we got together, at least with this COVID-19, that we move forward to include, non-discriminate the community and go forward as one UN. So it's important that we get that message across to the senior managers and the Secretary General. Having said that, I have only 5 minutes, as Nanu said, so I would like to talk a bit about what we do in the Critical Incident Stress Management Unit, what we call CISMU, UNDSS. We are located in the headquarters in New York, and as you can see from the slide, that our mandate is to coordinate and provide psychosocial services for the United Nations Security Management Systems personnel in the field. That's all of us who are at risk of or are experiencing stress and critical incident stress. Now, this is a grand statement. We have been mandated by the General Assembly in 2004 to carry out these activities, and in a very protracted crisis like what we are experiencing now, COVID-19, CISMU is the global lead for all psychosocial support services, regardless of the communities we belong to. So that's what our mandate is. And as Nanu mentioned, I am the Regional Stress Counselor for Asia Pacific and Russian-speaking countries. And I oversee 59 countries in the world. And then we have 4 other regional counselors located in New York who look after the rest of the world. So next slide, please.
You have the presenter rights, so you can click the arrow on the left-hand side if you see it on your screen. There's a little panel that has a number, and then there's an arrow beneath it. Let me know if you can't find it, and I can do it for you.
Okay, let me just say. Oh, sorry. What did I do? Oh, I did something.
Okay, let me go ahead and take back the presenter ball. It's okay.
Okay.
WebEx is a new platform for a lot of people. Okay, so
I'm
all right,
not
you should
one
see
for
it now.
technology. Right.
No worries.
Yes. Yeah, I think that's the, is that the second slide, is it? Yeah. Or I think there was a second slide. Is that the second or the third? I have 3 slides. Yeah.
This is your first one, and then this is the second one.
Yeah, thank you. Thanks.
Sure.
Jen. So what's the network like? And you can see the statistics there. We have 318 counselors and counting, because we are recruiting at the moment in different countries, in 128 countries who speak over 80 languages. So, and who are we? So we have in the field, well, you know, we have missions, DPA and DPPO missions, and we have UNDSS in most of the member states. That's about 150 countries out of the 193 member states. So we have 82 located in missions and UNDSS. We call them in-house counselors. Then we have a group called external mental health professionals, 146 and counting. They are private practitioners who we train. CISMU trains them and certifies them, and they're available for a fee for our staff for services. And of course, as you can see, the CISMU UNDSS manages this group of people. Then we have in headquarters, Staff Counselor's Office in New York. We have 3 counselors. That's for New York staff. And then they also manage the Geneva, Nairobi, Jordan, Addis, Santiago, Rome, Bangkok, Austria counselors. There are not that many, but that's the number of counselors in headquarter locations. Then we have UN agencies, funds, and programs that many of us belong to. And when I spoke with Nanu, you work for IOM, and many other colleagues, I'm sure, belong to UN agencies, funds, and programs. And as you know, UNICEF, UNHCR, World Bank, and WFP, they have counselors in these locations: Geneva, Vienna, Nairobi, Bangkok, Dhaka, Kathmandu, and in mission locations like South Sudan, and Afghanistan, etc. So there are a group of 72 professionals, and this group is managed by the UN agencies, funds, and programs chief and regional counselors. Now, that's a lot of information to digest, but what I can say simply is in a crisis like COVID-19, which is a global crisis, in any emergency for that matter, CISMO takes the lead, and we make sure that our staff get the right services for any mental health concerns that they may have. So I can see that today there'll be panelists talking about anxiety, isolation, discrimination, intimate partner violence. We have counselors who are trained in every aspect of COVID-19 psychosocial concerns. As you know, they are not new. These concerns are not new, just exacerbated by the current crisis. And we also have counselors who actively communicate with the LGBTIQ plus community, and we have amongst counselors who also belong to LGBTIQ community. Next slide, please, Jen. Yeah, so the last slide I have is if you ever want to contact a counselor, if you are not in a location where there are counselors or you feel uncomfortable talking to that counselor, you're welcome to write to us in New York, and you can see the names, telephone numbers, and the emails of the Critical Incident Stress Management Unit counselors. And you can see my name, and then we have Africa West, Europe and Americas, Middle East, and North Africa, and Africa East. So please feel free to write to us, and we will connect you with the appropriate counselor. It doesn't need to be the person in your agency, or it could be somebody from a place that you feel comfortable, or a person who you would like to be in touch with as a counselor. So we do all that. So please, we are there to serve everyone, and especially the vulnerable groups. And that's my message for you today, and thank you very much.
Okay, thank you very much, Kalhari. Thank you very much for sharing your time today. And like I said with your colleague last week with Teresa Fitzpatrick, this is the start of a discussion, and hopefully a start of a partnership where we start working together as well, perhaps like we discussed over the phone, training the counsellors as well on LGBTIQ issues and how they can better help our members. Thank you very much for your time and such short notice as well. Now, before I hand over to our next panelists, I'd like to introduce them. We have Richa Vishista. Her pronouns are she, her. Richa is a queer mental health professional working in the intersection of gender and sexuality in India since 2014. She has a master's in clinical psychology from SNDT, University Mumbai, and she provides therapy, conducts training and workshops on mental health care, LGBTIQA and gender sensitization for colleagues and corporates. She also speaks various national and international forums like ours today, advocating about the importance of mental health, LGBTIQA rights, and gender equality. Currently, she's a mental health consultant for two companies, Connect and Payment Insider. She's worked with the Homophobic Trust, HST, for 4.5 years as a clinical and counselling head and research interventionist, working for the health and human rights of LGBTIQ people in India. During her time at HST, or Homophobic Trust, she provided support and therapy to individuals and families of LGBTQ who faced mental health issues through individual family and group counselling. We are also joined today by Yangfa Leo, who is a registered social worker in Singapore and executive director of Ugachaga, I hope I'm pronouncing that correctly, an LGBTIQ organization working with individuals, couples, and families. Prior to joining Ugachaga in 2013, Leo or Yangfa he worked for 8 years with Samaritans of Singapore, a national suicide prevention center in the area of suicide prevention, intervention, and post-vention. He has edited a collection of real-life personal LGBT stories from Singapore called I Will Survive, which is now in its 3rd edition. Yangfa is queer and cisgender, vegetarian, and proud gunkle of 5 nieces and 2 dogs. So Yangfa and Richa, on behalf of UN Globe, its board, its members, coordinators, a big thank you very much. Thank you for joining us today. Over to you.
Thank you for such an amazing introduction, Nana. I'm so glad to be here. I think it's a privilege to be a part of the conversation talking about LGBTQI and during COVID, especially with the UN staff.
Sorry, Richa, could you come a little bit closer to the microphone? We're having technical issues with hearing. Could you come closer?
Yes. Can you hear me now?
That is much better. Thank you very much. Yeah, perfect.
All right, great, cool. So, okay, so I think what we're going to do right now is, as you see the first slide, what we're going to speak about today is creating safe spaces and keeping well. And what I'm going to focus on is creating safe spaces, and then Yangfa will focus on keeping well. Like Nanu has already mentioned, what I think my work right now during COVID-19 has been around helping queer people create safe spaces for themselves at home, because if a lot of us in India, or like the whole of India right now, is in a lockdown situation where we cannot really get out of homes. And overall, when I've been reading a lot of reports and hearing from other countries and continents, there is a rise of a couple of things that I'm going to speak about. So my first slide here, I'm going to speak about LGBTQ individuals in queerphobic environments. I'm going to talk about the rise in gender-based violence and what you can do in such situations, and a little bit on mental health concerns. And I think Yangfa will speak a little more on self-care. So what's happening right now is that people who are in queerphobic environments. So first, let me define what a queerphobic environment is. So as Nana said earlier, a lot of us who identify as LGBTQ are not lucky that we do not really come from supporting environments. So I identify as a queer and a cisgendered individual myself. But I'm lucky that I have a supportive family. I have a supportive partner. I'm rather privileged that I'm not in a difficult situation, or not in a situation of compromise. But there are a lot of people, a lot of my clients right now who are in queerphobic environments where people are not okay with their sexuality or gender. There are a lot of people who are not out to their family members, or not out with the people they're living with, but this is also not a space where they can express themselves. So I have a lot of people who've been telling me situations about parents already bringing up conversations around marriage. And when I'm saying marriage, it's about marriage to the opposite gender, and not somebody who you'd like to get married to. Of course, in India we do not even have those rights, but yeah, let's not get there. Then we have a lot of queerphobic individuals who are speaking about how sexuality is not normal, it's not okay. Use this time to, convert yourself, become straight like us, and, do not. I don't think it's okay for you to be trans. A lot of people don't even understand what trans is, and this makes it very difficult for queerphobic people, for queers or trans people or non-binary people to live in those environments. Next slide. What's also happening is that there has been a rise in gender-based violence. So whether it is physical, sexual, psychological, in India, we're talking about so many cases of domestic violence that have been all the media that I read, just the numbers keep increasing. there has been an increase in intimate partner violence as well, which is problematic because if you are stuck in a lockdown situation with your partner, there is no way out of it. You have to stay with this person and you don't know what to do or you know how to get out of it. And that also then further, like if we talk about queer-phobic environments, talk about gender-based violence, it increases the mental health concerns of that individual. So we have two things here. Your mental health issues are increasing because of gender-based violence or you living in queer-phobic environments, but also as to how COVID-19 and how there's so much of uncertainty around is then leading to either people experiencing a lot of anxiety, having episodes of depression, feeling suicidal. There's so much of dysphoria, which I'd like to talk about. You know, there are moments where people want to harm themselves. There's so much of self-harm happening. So I think this is very alarming because while we are trying to talk about LGBTQI rights, we're trying to talk about safety and self-care, but I think there are a lot of individuals who don't really have the chance to just be themselves. And I think when we talk about the choice of being yourself right now, I'll give you an example of a current client right now. So I have a client who is a 29-year-old trans individual, and they are staying with their family. What's happening is that their parent is constantly dead naming them, and that really creates a lot of dysphoria for them. So they don't know what to do in the situation. They keep reminding their parents that, this is not the name I'm okay with. Why don't you use this name? And they were like, no, but this is the name that we gave you. You're supposed to go by this name. So they don't understand what does gender identity mean. If they would want to express themselves or, express themselves in terms of their gender, that's not okay as well. So that makes it very difficult for them to live in those environments, and that increases the level of dysphoria. So what I'm going to talk about right now is that if you know anybody who is in this situation, or if you feel you are in this situation, I think there are certain things that we can do as individuals, as organizations, as a collective. Firstly is about how can we tackle violence and uncomfortable conversations. So this is what's happening with a lot of people where family members are constantly coming up with situations where you have to get down into a confrontation, and that's difficult. You don't know what to do. So here are these things I've been telling a lot of my clients, that you should limit your conversation with people in the house who act as a trigger for you. So let me explain this better. So if I am at home with a roommate, okay, so maybe I'm staying with the roommates, and maybe one roommate is homophobic, and she does know about my sexuality, but she'll say very mean things, very insensitive things, and for me that's a trigger, because as soon as she says something, she's invalidating my feelings, she's invalidating my identity, and I'm not okay with that. So that is an entire trigger. So at such times, try staying cordial with such people. Try not getting into confrontations with such people. Try limiting your conversation when you feel like you're getting into an argument with this person. Remind yourself as to what's in your control. So there's something called as what's in your control and what's not in your control. What's in my control is the way I am reacting to situations right now. What's not in my control is the way they are reacting. So I can't control the way they're reacting, but what I can control is that maybe I do not have to respond back to them, because if I do, it's only going to continue. So I'm going to stop myself there. I'm going to find a safe space where I can just use that time to gather all my thoughts, all my feelings, and once I feel like I'm a little better, I can just go back and continue staying cordial, because this is not the time to get into arguments. This is not the time to get into confrontations, because we don't know what could happen next. Another thing is, I think a lot of we've been using this time and we're saying that, oh, social distancing, but I think it's also important that you use this time for physical distancing, but technology is amazing and we can absolutely reach out to our loved ones. So I think use this time to, reach out to people, and when you do from a safety point of view, create code words with the people you're speaking to. So if you're speaking to other queer people, but you do not want people around you to know what's happening. You could use code words for your people to understand what conversation you're having, but not for people around you to kind of get a doubt of what's happening. So use code words. It could be anything. It could be like, I will not use the word queer, but I could use another word for it. It's just that we're just trying to do this so that we can stay safe during such times. So, reach out to people, show affection towards other people at this point of time, show affection towards yourself. So if you feel like you've finally, you did get into an argument with a queer phobic person, you did not know what to do in that situation, it's over right now. Take some time to just reflect on what happened, show some affection towards yourself, because you don't know if there's anybody else in that moment to actually be there for you. So it's very important that you use this time to protect yourself, you use this time to stay connected. And another thing that is tricky, but if you can do this, it'll be great. If you can set boundaries with people you are in an uncomfortable situation with. So when I'm saying setting boundaries, this is how I'd like to explain it. Again, so if you are in an um, unfriendly environment, and if there are people talking to you in a certain way, you could let them know in a very subtle, comfortable, tone that, okay, I'm not okay with this. Can we not speak about this right now? So you're setting boundaries about what conversations are okay at the moment, what conversations are not okay at the moment. Now, that really depends who are the kind of people you're sharing spaces with. With some people, setting boundaries might be possible, but with a lot of people, setting boundaries might not be possible. Okay. Um, Now we're also going to talk about coping strategies for mental health concerns. So I think this is very important. Firstly, to understand that during COVID-19, what is really happening with your mental health? Like, if you have to question yourself, okay, what am I feeling? What am I experiencing? And of course, no two people are going to feel and experience the same thing. But what's happening with a lot of people is that this uncertainty is taking a toll on their mental health. It's like your brain's very confused. You don't know why you're feeling a certain way. You don't know why your sleep patterns have changed, and why you're getting into constant arguments with people around you, although you thought the situation was okay. This uncertainty is a reason for anxiety to increase. And when there's so much of uncertainty around us, we don't know if the situation is going to come to control very soon. What we can do is, try to take into control, again, going back to what I was saying earlier, think about what's in your control. So maybe what's in my control is having a routine around me. It's maybe something that, I can have a routine around me. And maybe this is something that Youngfa will talk about later, but what I want to say over here is that it's important for you to think about what's in your control and how you can manage around it. So in case, because of a lot of difficult situations, you don't know how to take care of yourself, these are some techniques you can do. So there's something called as the grounding technique. So if you are very anxious, or you've had a panic attack, or you feel like you want to harm yourself, or you've had a very heated argument with someone, and you feel like things are very difficult for you right now, there's something called as grounding technique. There are a lot of you'll find a lot of applications on Google as well as to how can you do grounding technique, but it's basically trying to stay in touch with your senses. So that's one way of how you can do. So I think if you have to get into it, it's about what are the 5 things that I can see around me. At that point of time, think about what are the 5 things that I can see around me. Then it could be about what are the 4 things that I can touch. So at such times, a quick fix would be getting an ice from the fridge. So just get an ice from the fridge and hold it as tight as possible. Like, if you can see my hand, hold it as tight as possible. In that moment, you'll realize that all that you're probably thinking about, you will use that energy to probably just focus on the ice in that moment. That's also a form of grounding. That's also a form of grounding yourself. So there are different ways of how you can focus on grounding. Again, like I said, that there's a lot of information available online that you could use. Second is, you could use relaxation techniques. I think at this point, a lot of us are using this time to, focus on any kind of deep breathing because we are feeling anxious, we're feeling very panicky. So, try doing some form of relaxation technique. It could be anything. It could be just a lot of deep breathing. That's something you could do. You could do yoga. And another very important thing is self-affirming activities for people who are going through dysphoria at this moment. So this is mainly for people who identify as non-binary or trans. What's happening is that you are in situations where you cannot express your gender, and that gets very difficult for you. I know certain people who've been telling me that my hair is growing, and I've wanted short hair. I do not like the fact that my hair is growing, but I can't really go for a haircut at the moment, or that I do not wish to wear this clothing because it makes me look feminine. I wish I could just wear a shirt. So for people who are going through some form of dysphoria, if you can use this time, if you can find a certain space, it could be a bathroom. Like for a lot of people, they're actually going to the bathroom. So if it's a trans woman, there's this one trans woman I know, she would probably go to the bathroom, put some lipstick. That makes her, remember the times before COVID-19, and she feels a lot more like herself, which she probably cannot express because she's staying in a very queer-phobic environment. So I think it's about how you can use different self-affirming activities to reduce your dysphoria. Also, I think when we're talking about positive affirmations, it's about reminding ourselves that this is just a situation that we're all dealing with right now. This is not what the rest of my life looks like. It's going to change at some point. Maybe, maybe right now I'm just finding it very difficult to cope with it, but remind yourself that this is not the end of everything. Okay, there is going to be a time when we're going to come out of it, and you will get to meet your queer people, your family of choice, and till then, I think it's just better to stay safe, to stay indoors, to stay as cordial as possible with the people you're sharing your spaces with. And yeah, that's pretty much what I wanted to cover, and I have made it crisp. So thank you. If there's anything you'd like to ask, you can do it after Youngfa speaks. I've also shared my email address, so if you want to reach out to me personally, you can absolutely do that. Again, I'm really, really grateful to be a part of this conversation and talk about the importance of mental health during COVID-19, especially for people who identify as LGBTQ. And all I want to say is that remember that you're not alone. We're all in this together, and let's hope that the situation gets better soon. Thank you.
Richa, thank you so much for that very insightful presentation, and lots of strategies of how to cope and create safe spaces and to use those spaces around us to feel safe, as we did once before. Before I give the floor to Yenfa, please don't forget, you can send your questions to Jen Rumbach, the UN Globe Treasurer and host, through the chat function. You can access the chat function by clicking the talk bubble. It should come on as blue, and clicking on the button, center of your screen, it'll come on blue, and then you can send a message directly to the host. All questions will be kept confidential when being presented to the panelists. So you can access the chat function by clicking the talk bubble on the bottom center of your screen, and you can send a message directly to the host. All questions will be kept confidential. All right, thank you. Yangfa, the floor is yours. Thank you.
Great, thanks so much, Nanu. Thanks, Risha. So just to give a bit of background to how we thought of this discussion, how we wanted to frame this discussion, because we decided that, well, safety is important, and so is self-care. So we thought we'll do a bit of a double act between Risha and myself to have this conversation about two very, very key topics when it comes to talking about LGBTQ plus mental health, certainly during this very, very difficult time. Just a quick note on language terminology. Along the way, I might say LGBTQ plus. If I get a bit lazy, I might just use the word queer by means of an adjective. So if anyone is uncomfortable with me using the word queer, please drop me a text and just let me know, and I'll make a point to be more conscious about saying LGBTQ plus. So And also, I thought, well, a bit of self-disclosure, I'm quite a quite a visual person in my work as a counselor, as a social worker. I often share with the people I work with, my clients, how using images or using imagery, metaphors often helps in the conversation. And I thought, I'm guessing many of us in the audience here might have sat through various WebEx and Zoom webinars. And I personally find that kind of it gets after a while it gets a bit a bit less interesting to see the person who's making the presentation. Usually, hopefully it's a bit more interesting to see more visuals. So I decided to just have a bunch of visuals on the screen. So may I just extend a kind of a gentle invite for some of you who may be just tuning in on the audio because you're multitasking, getting some work done. If you like, could I invite you to come back and just join us in some of these images that I'd like to share with you. So maybe I'll just start off with this first image that I've got. So talking about self-care tips, this is actually the rainbow heart that the British artist Damien Hirst released sometime last week, if I'm not wrong, and he's released it publicly for free download. Just Google it, you can find it. And I thought I'd just start by maybe reminding all of us here that, actually it is okay to acknowledge our feelings. Feelings are feelings. They are what they are. We all have them. And as humans, we're actually quite capable of having multiple feelings, often at the same time. And just to run through some of the feelings I felt, my clients felt, my family, my friends, people I know have felt feelings of anxiousness, anxiety, frustration, fear, helplessness, hopelessness, and grief and loss and trauma, which sadness. And I think this is something that we probably just need to acknowledge that this is what we are feeling, what we're going through, and also many people around us are feeling these feelings too. That grief and the loss, some people have described as a collective sense of grief, loss, trauma, that's very real. I know a friend recently talked about how he's finally found the word to describe the physical sensations he's been feeling for the past 2 weeks, and that's grief. Because grief, for those of us who have experienced grief and loss, or multiple griefs and losses in our life, it can have a different impact on us. It can have a different impact on different people, and it can impact us at different times. So I suppose what I'm getting at is putting words. That's one way to describe our feelings. For other people, there may be other ways to describe or express their feelings. Something we know about, something else we know about feelings is feelings are often temporary. And it's okay. I think it's okay for us to let them come and let them stay and let them pass as well. And maybe, again, as you're reflecting on your own feelings and how you feel and how other people are feeling as well, maybe give yourself some time to think about how you experience and feel your feelings. And whenever you have these feelings, what do you do with them in the past? What do you do with them now? So that's kind of like the first self-care tip, acknowledge our feelings. And for the second image, just want to share with you here is a line and the person standing behind the line. So it's linking back to what Risha was mentioning earlier about boundaries. So there's a very visual representation of a boundary. And I know for many of us, we may be familiar with the concept or idea of boundaries. And if I'm not wrong, many of us think of boundaries as something physical. I just kind of want to maybe go back to the idea of boundaries, why we have boundaries. Actually, boundaries are really important. Boundaries protect us, they keep us safe, and maybe also useful to think about how there are actually different types, or we can have different types of boundaries as well. So physical boundaries is one. Many of us are staying at home, working from home. For some of us, we may not have the luxury of physical space. Some of us may have that. So we're putting in place those boundaries to protect us. That's important. Other types of boundaries include emotional boundaries, what I might call relational and social boundaries as well. One example I can give of a non-physical boundary, I call it a social boundary. For example, when we are in all those chat groups, WhatsApp chats or DMs and PMs and all that with our friends, our peer groups, even colleagues, family members, I think it bears a bit of thinking about what kind of boundaries we might put in place. For example, maybe we just don't want to talk about COVID in our family chat group. Put that in place. Or maybe with your best friend, with your partner, there are certain things that are just off the table. So maybe some boundaries can be put in place in some of those social conversations, or even in certain relationships with the people we care about. We focus on these things when we talk, when we spend time together, the people we live with, for example. But let's not talk about those other things. Let's not go there. So those are possible ways of putting in place boundaries in different contexts. So physical, emotional, relational, and social boundaries. Next image. So 2 images here. Let's start with the one on the left. The one on the left is actually the Buddhist symbol for compassion. And so compassion is kind of like, I suppose the textbook definition would be, about being kind to others and to ourselves. I suppose so I go slightly reflective and invite all of us to think about, how are we kind to ourselves? Even I'm guessing in all your work with UN agencies across all over the world, you do a lot of important work that involves a lot of kindness, serving, working with other people. How about for ourselves? Where is that kindness for ourselves? What do we need to be kind and compassionate for ourselves, even as we continue to be kind and compassionate to others? For example, just a couple of days ago, I had a difficult case, a client to handle, involved a few difficult emails and phone calls. So just working with a few people. It got a bit tricky and testy after a while. I found myself having to just literally stand up, just walk away from my laptop and the phone and just, remind myself, I've done what I can for that situation. I needed that 2 minutes, 3 minutes to be kind to myself, because perhaps that's what I need just for that moment before I go back to the next email or phone call. The feeling of being overwhelmed. Isn't it okay? Isn't it okay to take a break? Isn't it okay to, take a rest day? I invite you to look at the image on the right, on that slide there. That's I describe as a dimmer switch. Wherever you are, maybe that's what you call it too. So it's kind of different from a light switch where it's on off. Even though this tunes on off, it also dims or brightens the light. It's a dial, basically. And so it reminds me that it's also about knowing when to disconnect and reconnect. And for those of us who attended last week's session, I think it was Simon who mentioned about the importance of disconnecting and also connecting as well. I want to kind of come back to that. The idea that, it's linked back to the idea of boundaries and relationships. And the work that we do involves so much contact with people, so many connections. It really is hard for many of us to switch off, as in light switch off. Maybe sometimes we might just need to adjust that, reframe it, and think of it as a dial, a dimmer. Sometimes instead of switching off, because that could be hard, maybe just dialing things down a bit, kind of cool things off a bit. I know in a lot of the work that we do with people, it involves empathy, relating to other people. It's about emotional sensitivity. Personally, I find and I believe that it's actually difficult to switch off empathy. I think a more realistic way of reframing or framing it is maybe there are times where we need to up the empathy a bit. I call it warming up the empathy. Brighten, turn the dial in a way you're brightening the empathy. And then there are times where perhaps you are tired, it's the end of a long day, it's the end of a long week. We might just need to dial it down a bit, turn the dimmer switch down a bit, just keep to factual empathy rather than emotional empathy. Dial down the intensity sometimes. Dialing down, adjusting how intensively we relate or respond to others emotionally, knowing when, very importantly, knowing that there are times when we need to save some of the empathy and emotional sensitivity for ourselves. So that the image of a dimmer switch, I hope that helps to remind us when to disconnect and reconnect with ourselves and with other people. Let's go on to the next image there. On the left, there's the image of a person embracing, hugging themselves. And so embracing, as a noun, as a verb. Perhaps it's painful, it's difficult. I think still needs to be done. Embracing the now, embracing, and it will take time, embracing that current reality and uncertainty that we're living in now. The embrace is not so much in a fatalistic way, but maybe in a way that's kind of recognizing that it is what it is. We can't change systems overnight. We can't find a vaccine overnight. We can't lift the lockdowns overnight. But we'll work on it. We'll work on it. We'll embrace the reality that the world is working on things bit by bit, gradually. And also the recognition that slowly, as we're learning to embrace the current reality, also embracing that new normal, embracing the little changes that are happening in our lives, embracing the changes that maybe we need to make in our lives, embracing the changes that you notice in yourself, whether it's emotional or behavioral. For example, here in Singapore, we are into our fourth week of our partial lockdown, and I'm finding that I'm living and working at home with my parents. I'm finding that I'm spending a lot more time with my parents. Not through choice, of course, and yet it's something that I'm kind of acknowledging that it is what it is. I can't be anywhere else. It is what it is, and I'm trying, hand on my heart, I'm trying to make the most of it, to make the best of it, out of it. So that's kind of my way of embracing that, the current reality I live in now. Draw your attention to the image on the right. It's a clock. So maybe it's a reminder of following routines. Risha talked about routines earlier, and routines, many of us know, many of us have routines. And I was just thinking about why routines are important the other day, and I realized for me, routines are important because they are familiar and they're comforting. They serve a purpose, and they're familiar and comforting for me in this scary world of uncertainty. That routine of knowing that dinner is going to be at 7 o'clock with my parents. Much as I prefer to have dinner other times or skip dinner sometimes, but knowing that dinner will be ready for me at 7 o'clock, that's comforting in a strange way. And also that routine, another routine I continue doing is listening to classical music when I'm working. It's something I've always been doing in my office before all this happened, and I'm continuing to do that. While working from home, I'm still following that routine, and that's comforting. The act of listening to classical music is comforting. Classical music itself is comforting because it's familiar. It also reminds me of a place and a time where things were more within my control. So again, I offer that as another self-care tip, following routine. Let me just go to the next image, just a couple more. So that's an image of a rubber stamp with the word permission granted. And that's a reminder, that's a very stark reminder that we can give ourselves permission. We can give ourselves permission to do things. The above things that we talked about, all those tips, to do things the same way, to do things a different way, to take a day off, to work harder than usual, to work less hard than usual, to spend more time with people we care about, to connect with them, or to just, be with ourselves a bit, and just cut ourselves off for a little bit. If that's what we need, I think we can give ourselves permission to do these things. And just this last image is actually a photograph, and it takes a little bit of explaining, so I beg for your indulgence. It's actually a photo I took of myself on holiday in Chiang Mai, in Thailand, in fact, in the hills outside Chiang Mai, the city. So if there's anyone listening in from Thailand, Saudi Arabia, beautiful country that I look forward to visiting again when all this is over. So it's an image of me in the hills outside Chiang Mai with an elephant. And there's a dog there as well. We are just walking along the river. And this photo was taken sometime last year. And I chose this photo because it reminds me of a time when things were different. It was a very enjoyable holiday. And as I was looking at this photo and putting together this presentation, I kind of almost unknowingly transported myself back into that place and time when things were hopeful, when things were different, and I kind of connected with my senses. Actually, what Risha was talking about earlier about engaging our senses. I kind of remember what it felt like to touch her, the elephant, her skin, and the smell that if anyone has ever been anywhere close to an elephant, you know how they smell, that beautiful earthy smell, and how she sounded when she walked, almost noiseless. And also, after this photo was taken, we had to cross that river that you see in the background, that freezing cold water. We had to walk to a spot in the hills where we took lunch, and memories of the flavors and taste of that gorgeous Thai veggie lunch that was prepared for us. And of course, the sound of the dogs, the other dogs as well, which you can't see in the photo, and the rumbling noises the elephants make. And so this brought back all these beautiful memories. And I remember talking to somebody recently about how she's actually started a future bucket list. And a future bucket list is things that you want to do when all this is over. You put in a list and you look forward to it. So this photo I'm sharing with you, the point I'm trying to make here is about hope, about having hope. And hope is something that we look forward to in the future. And hope is something that we all have because we all had hope before in the past. So hope is not just forward-looking. Hope is about now. Hope is about the resilience we had and the resilience that we can tap on because we have been through various episodes in our life before, and we can tap on all that resilience. And I also just want to, and I'm reminded the name of this elephant, her name is Happy. She came from a very painful, abusive background, and she's now part of this non-profit community program where it's called the Elephant Nature Park. They rescue retired and injured and abused elephants and for basically a program where they can continue to interact with tourists as part of an ecotourism program. So this photo of me with Happy the elephant just brings back such beautiful memories. And just as kind of a summary of the points that I've just made, for those of you who may have been more observant, you notice that it was kind of an alphabetical order. So acknowledge feelings, be for boundaries, compassion, disconnecting and reconnecting, embracing, following our routine, giving ourselves permission, and to have hope. And please, we'll make these slides available. Please feel free to share these tips with people around you and keep them for yourself as well. Thanks, everyone.
Okay, thank you, Yangfa. Thank you for this very interesting presentation and another unique way of understanding mental health and how to understand our own feelings and emotions here. So just before we go on, I just want to announce that UN Club advocates for the equality and non-discrimination of all LGBTIQ staff in the UN system and its peacekeeping operations, including consultants, UNVs, JPOs, affiliate workforce, and interns. And UN Globe and its board members, its coordinators are volunteers. We have no official UN funding. UN Globe thus relies on contributions from our members and various UN entities to bring you programming and to support UN Globe activities in the field. So we kindly ask you to consider making a contribution through our PayPal account. Any amount helps. Thank you. The link is being shared by Jen. If you have any questions, please don't forget that you can actually send them directly. You can access the chat function by clicking the talk bubble on the bottom of your screen. You can send them a message directly to the host, and all questions will be kept confidential. For those who are using those who are using mobile devices, chat is under the participants list rather than at the center of the screen. So you can see that if you look on your mobile devices, that the chat is under the participants list. So again, a big thank you to Richa, Yangfa, and Kalhari. So over to you now, Jen, for the questions from the participants. Thank you.
Okay, thank you, Nanu, and thank you to our panelists. We have a lot of great questions. I'm going to start with a question for Richa. The question is, can we please explain more about the safety kit that you mentioned in your presentation?
Hold on. Hello. Yeah, I'm so sorry. I did not realize that I did not mention that. Okay. So basically, thank you for bringing that up, first of all. So when I say a safety kit, it is like a first aid kit, but also adding some things to it. So things that you can keep in, things that you would keep in a first aid kit, like a bandage, any kind of Dettol, and just things that you would need if you get hurt. Also, what people add to a safety kit is positive affirmations into smaller boxes that you could just add into it. So you could probably pick one of the chits which could say that my worry is not going to bring me down, or this is not what life's going to be like, but this is just a situation we're dealing with right now. So when we write these positive affirmations, because we might not really be getting those affirmations from people right now, it helps in the situation that we are in right now. It helps lift the moment and just realize that, okay, it just feels like a difficult situation. I am going through a lot of emotions. I'm feeling a lot, but maybe tomorrow is going to be a different day. So different things that you could add into your safety kit that could just help you feel better. Another thing that you should do is make sure there's enough ice in the fridge, because if you reach a point where you would also either you're getting hurt or you want to self-harm, make sure that there's ice so that you could use it after something like this happens. Of course, we don't want for such situations to take place. But yeah, that's basically what the safety kit is about.
If I may just kind of chime in, just specifically, Risha, you mentioned about self-harm. I've got some experience of working with people with self-harm or suicide ideation, and different people experience self-harm differently, or different people find different intentions for self-harm. Risha mentioned ice. Ice will be particularly useful for people who find that they need to self-harm, and it fulfills a very tactile, sensory kind of objective. So that would be useful for people. So instead of, for example, cutting yourself on your hand, you might just want to hold ice because it's very cold, it stings, so it has a similar sensation to it. I do know for some people, the intention of the self-harm is a very visual kind of stimulation. So for example, somebody who might, somebody who gets a visual stimulation of self-harm, what we suggest is, instead of harming yourself, maybe use a very brightly colored marker. For most people, it might be red or green or purple. So use that marker and draw on yourself, or draw on the body part where you otherwise self-harm. So that's for somebody for whom the self-harm is a visual trigger, so tactile. And for some, another option to holding ice. If ice is not available, we also know that you can crush hard paper. So because that sensation of the crushing tough, maybe cardboard or paper in your hand can have a very tactile, sharp feeling as well, without harming yourself too much. And also rubber bands as well. So the rubber band can have a combination of the visual for some, like maybe a bright red rubber band, and also the tactile, the feeling of twanging the rubber band on your skin as well, and they have a similar effect as self-harm, but in a much safer way. So there's some tips for consideration.
Okay, great, thank you. And another question for Richa. What do you think of creating digital safe spaces? Can you talk a bit about the utility of those and what those might look like?
Right, absolutely. I think this is the perfect time to create digital safe spaces. So there's this concept that a lot of people around me follow. For queer people, we follow something called as family of choice. So we would have like a biological family, people who we probably stay with, or people who we're connected to biologically, and then we have this entire concept of family of choice. So my own queer circle, I have my own family there. So personally, I have, I'm facilitating certain queer healing circles, which are based out of India. So there's something called as the One Future Collective. It's happening actually on the next Sunday. So that is a queer digital space for where people to get together onto a call, and we pick a topic that we can speak about, because if you are in queerphobic environments, this is probably not a time where you could talk about certain things that you would use this time to talk about it. So I think when you are getting onto these kind of conversations, you could probably talk about sexuality, you can talk about gender, we can talk about relationships, love. So yeah, these are I think this is a wonderful time to be a part of such conversations. I'm not really sure about different things happening in other parts of the world, but please try finding out if there are digital conversations.
Okay. One of our participants has a comment for Yangfa. They said, "Thank you for finding the words to describe how I, for one, am feeling." And I think many of us would echo that for all of our panelists. I also have a question for you, Yangfa. In regards to empathy, the participant says, "I consider myself a very empathetic person, and I find it hard sometimes to use the light button and fade it out. How can I deal with very strong emotions, which can be overwhelming at times?"
Yeah, and that is difficult. I mean, as I'm hearing you phrase that question, I'm also hearing that you are acknowledging, you are aware that this is something that you've been experiencing. I might, again, not knowing the full context of some of the difficulties you might be facing, I might be curious to know, are there specific situations or specific people where you struggle in terms of these overwhelming emotions? Again, just a bit of from my personal experience. I mean, in my early days of training to be a social worker and counselor, I was practicing a lot of my empathic skills, my listening skills, my good old-fashioned counseling skills on my family members. And I found that was difficult because that's a very, in my family at least, a very unnatural way of relating, because in my family, we don't relate in a very emotional level. So to even try to speak that language of empathy and to use emotional language in my family, that was very, very taxing for me. So I kind of learned that in a family context, for my sanity, for my own emotional safety, I don't need to use empathy. So I know in that context, I dial it down. I turn on the dimmer switch, right? In my work setting, maybe with some of my friends, I know that, because of my role, because of my relationship with them, I would dial it up a bit more. And so fortunately, with that in mind, when I'm at home, I don't need to worry about using my empathic skills. I can be with myself and my feelings alone without having to worry about, having to be the empathic person with my family, because I'm really performing that role in my relationship with my friends and my colleagues and the clients I work with. I suppose what I'm suggesting is just kind of maybe sit down, give yourself some time to think about the different contexts, different relationships where you find yourselves being more confident and comfortable in using or engaging emotions. And are there certain situations where it really just is too difficult, it's too overwhelming? Save some of it for yourself. And when I say save some of it for yourself, that's where you may switch it off and give yourself that permission to just time out. And it might mean it's a known fact, actually, for many people who are empathic. Many of us actually are closet introverts. So as an introvert, I think we need to find time for ourselves to recharge from within. Find yourself that space and time. Take a break from people sometimes.
Okay, thank you. I have another question for you. Can you tell us what is the definition of self-care and what is the cost of not taking self-care seriously?
With self-care, I think, anyone can Google a textbook definition. Well, I'm a bit sneaky in that I would invite all of us in this room to define self-care for ourselves. If self-care means having a nice glass of wine at the end of the day, even before sunset, go for it. If it means, going for that second, third piece of chocolate cake after lunch, go for it. If it means, getting a bit later or working a bit later or doing a bit more work or doing a bit less work for that day, for that week, do it. I like to think that we kind of know what we need. And that second part of the question, that cost of not paying attention to our self-care, well, I mean, there's actually a lot of research and documentation, certainly in caregiving professions like ours and in professions where there's a lot of human-to-human contact, the very real danger of compassion fatigue and emotional burnout. And well, I was fortunate enough to attend a workshop by somebody who was quite experienced in this area, and she shared the difference between compassion fatigue and burnout. I think it's probably not uncommon for many of us to feel fatigue. It's a very real emotion, fatigue. And the difference between fatigue and burnout, according to the workshop I attended, fatigue is when we are tired and we are still driven to do the work that we do. So the motivation, the passion is there. It's that we are tired mentally, physically, in the work. Burnout is when we're tired physically, mentally, emotionally, and we don't care anymore about the work. That's a big difference. Do we still care about the work we do? So I think I would see that as the line between fatigue and burnout. More visually, fatigue is when we are maybe sitting in a room exhausted. Burnout is where we're quite close to the edge of the cliff already. So, and there's lots of information out there about the warning signs of fatigue and burnout. Maybe I can invite people to have a quick Google search, and if you recognize the warning signs of burnout in yourself or others, do take action. Get the support, get in touch with the UN systems. The support systems are available because mental health is at risk.
Okay, thank you. The next set of questions are for both of you. The first one is, what I find most difficult is to deal with the anxiety that comes from knowing my partner, who is in another country, is in a very dire situation, family, economy, bad working conditions, and I can't do anything about it. I would like to have a way to better cope with this anxiety and sadness.
Okay, so I'll go for it first. I think A is to, if you're really feeling anxious at the moment, going back to what I was saying earlier in the presentation, is we can look at certain grounding techniques, we can do relaxation techniques. It's important to maintain a routine during such times because there's so much of uncertainty. We are feeling helpless. Basically, we're really feeling very helpless. We don't know how can we take care or be there for our partner at that point of time. But I think what would also help in this situation is try being there for your partner in whatever way possible. So when I say that is just let them know that you're here to listen to them. Okay, it doesn't have to be like, we do not have to give them suggestions, you do not have to give them any advice. You don't know what how difficult it is for them at the moment, but all you can offer is your support. So I think if you can let them know that, you know, I'm here for you. If there's anything you need, I'm here to listen to you. So I think it's very important to just let people know very close to you that you're available for them at any point of time. And yeah, that's something that you can absolutely do. A is to deal with your anxiety. B is to also just, you know, let the opposite person know that you're available for them.
Yeah, echo everything that Risha is saying. And so I just add a point about grounding and exercises, especially useful for, because I hear this person may be experiencing feelings of anxiety. If there's any risk of panic attacks, grounding techniques are especially useful when you're having a panic attack or as you're about to have a panic attack, and different people may experience different symptoms. In my experience or my experience of working with people I know who have panic attacks, it might be a sense of breathlessness or tightness of the chest. So these are some real warning signs. And the grounding techniques that add on to what Risha said earlier, engaging the 5 senses. I know for some of my clients, they may be in a state of almost panic where thinking about 5 senses may be difficult. So we do what I call the express version. Just cut it down to 3. So instead of 5, 4, 3, 2, 1, we do 3, 2, 1. So 3 things Just ground yourself, look around, name 3 things you see around you, name 2 things that you can hear, and name 1 thing you can touch. So, and then once you've done the 3, then if the person has still not calmed down, repeat. And if the person is able, then move up to 5. So it's a process of 3, 2, 1, 3, 2, 1, 5, 4, 3, 2, 1, 5, 4, 3, 2, 1, engaging the 3 senses, engaging the 5 senses. So that's another tip to kind of make it more manageable for someone to do the grounding technique when they are feeling anxious.
Okay, and then related to that, there's a question: how can you deal with relationships that have ended during this time and deal with feelings of rejection and loneliness?
Okay, all right. So, so this is actually this is something that's also happened with some of my clients, where you are experiencing too many emotions because you did not see it happening. You probably did not know, or if you've been the person who vended it. First of all, I think it's very important that you give yourself this particular time to process what has happened. You might have a lot of different questions as to why this happened. You might have a lot of guilt. You might be in denial. You will be feeling angry. I think it's important that you remind yourself that all the possible feelings and emotions that you're going through are completely valid right now. So whether you're experiencing any form of anger, whether you're experiencing shock, it's all absolutely valid. But try giving yourself the time right now to process your emotions, your feelings. Maybe at this point, if you feel like you want to start journaling as a concept is basically a way of writing into a diary and expressing our feelings and emotions. It helps us be a lot more aware of what's really happening inside the head of ours. So there's this wonderful website called Journal Your Feelings. You can absolutely use that website if you are using journaling as a concept for the first time. But also, I think it's important to not pressurize yourself to, fit into the entire concept of normalcy right now, because clearly things are not normal, and you're not only dealing with COVID-19, but you're also dealing with a heartbreak situation. So I think that's something that I could share.
Yep, completely agree. Just to add very quickly the idea of, and I hear this a lot from the clients I work with, because they tell us that other people would say to them things like, you need to move on, you need to deal with your grief, you should this, you should that, you need to find closure. Well, personally and professionally, what I would say is, we all grieve differently, we all process loss differently, we all understand and experience loss differently. For some people, it may not be immediate. It may hit them in the weeks or days to come when there's certain triggers. So I might urge the person who asked the question, or other people who may be experiencing grief and losses, to listen to your body, what your body needs. Listen, acknowledge your own thoughts and feelings, how you feel about this, what you think about this. And if it means you feel ready or comfortable to connect with somebody, go and find that person. It may be a family member, it may be a loved one, it may be somebody you know, it may be a complete stranger, maybe a professional, maybe one of those anonymous hotlines. Go find that and listen to your gut. I call this the gut feel thing. If it feels right for you, do it. If it doesn't feel right for you, move on and do something else. Trust your gut.
Okay, thank you. So I now have a general question. What if not all of society can adjust with these new circumstances or acknowledge their feelings and just be normal or productive as usual?
Sorry, I just heard normal, productive. I missed the question there.
That's okay. So what if not all of society can adjust with these new circumstances or acknowledge their feelings and just be normal and productive as usual?
Right. I think this is so important right now because a lot of us are falling into the entire productivity trap, and we constantly either want to prove ourselves or people around us as to, how am I going to be a lot more productive, and I need to achieve so much. I mean, I'm constantly just fighting this fact that I need to achieve, I need to achieve. But I think that we are talking about a global crisis. I mean, this is a pandemic, so this is not normal. This is not the time where you are actually supposed to focus on being productive. It's not really a productivity test. So the way I think I'm really coping with this myself, along with a lot of my clients, is try setting smaller goals and targets for yourself. Like it could be anything that, have I taken a bath? Have I focused on my hygiene? Am I eating well? Am I drinking water? Am I like pausing and just breathing? These are these are also just things that we should focus on. Like that's it. Maybe you do not want to focus on anything else. But if you want to, I think just try setting smaller targets and goals for yourself. Don't create huge goals for yourself, because at the end of it, you're the one who's going to feel overwhelmed, and you're going to then fall into this entire self-critic thing where you would get into an entire spiral, and there are a lot of negative thoughts that would follow. So yeah, I think creating smaller targets for yourself, and when I say targets and goals, we're not talking about finishing off, we're talking about things that can help us survive on a daily basis. And I think it's important to take one day at a time right now. We cannot really plan something for 2 weeks ahead. We cannot plan for like a month ahead because we don't know what 1 month ahead is going to look like. So let's take one day at a time. Let's take baby steps, because that's something that might help us in the situation right now. I just hope that I managed to um, answer what you were asking, but if not, I think Yangfa can take it from here.
Just a very quick point I wanted to add about how, and it's not unusual, actually many of us are feeling it right now as something called survivor guilt. The fact that we are alive, the fact that we are somehow still cruising through this crisis where it feels like everything outside the window is falling apart, in the sense that we need to be productive for whatever reason. We've been conditioned to have to make the most of our time. And like what Risha was saying earlier, so yes, we have all this time, but then there's also limits to how much we can do. I know in English there's this beautiful word should. I think it's an awful word, that we should do this or should do that, should be more productive, should spend more time, should be able to cope. Rubbish. Let's stop being so unkind to ourselves. Let's challenge ourselves to use the word should in our day-to-day vocabulary. I want to take an easy day tomorrow. People might think I should not. I want to start a bit later tomorrow. I want to finish work a bit earlier tomorrow. I want to take a longer lunch tomorrow. And the next day, it might be a public holiday. I might want to put in a couple of hours work on a public holiday or not. And that's okay. Kind of norms are being renegotiated. Shoulds and should not, another time.
Excellent, thank you. Yangfa, one of the participants wanted to know, what is the name of the NGO or association for suicide prevention in Indonesia?
Okay. Actually, there must be one in Indonesia. A good site, maybe what I'll do is I'll just type it in now. There's actually, I'm trying to figure out how to type it into, yes. I'm just going to put in the website. It's called befrienders.org. I'm thinking, well, basically Befrienders, it's a global organization that networks all the various suicide prevention services all around the world. So go to the website. They've got a section particularly on LGBTQ plus issues as well. And additionally, they list all the suicide prevention centers all over the world. So I think probably by country or city. So have a look. They've got a pretty extensive database.
Okay, great. Thank you. We have the last few questions that are about the office space. So I've left them to cluster them together. The first one is from someone who says, I'm a gender focal point at my office. I've been working on creating safe spaces for LGBTIQ plus integration into our gender mainstreaming efforts. both internal and programmatic. But this is not easy and often not accepted, and it's made more difficult by working in a country where the space for LGBTIQ voices is very limited, and this is reflected in our office. I want to ask your advice. What can I do to support LGBTIQ plus colleagues' mental health within my organization, especially now during COVID-19?
Okay, I think that's an amazing question, and the person who's asking it has the opportunity to do something right now, so I think that's pretty amazing. So these are things that I'm doing, and you can absolutely do these in your own ways as well. So I think going back to what somebody was asking earlier around creating digital spaces for queer people, I think if we can create digital spaces. So if you are a part of a company, you could, and if you have like an LGBTQ group of that particular company, you could meet once a week either on any of these web platforms and pick an issue to actually talk about. So that becomes like a digital space for queer people. It's finally you get that space to express yourself, because I mean, if you have to understand what is this entire webinar series for, it's all about being seen, being heard, being equipped. So a lot of us really want to be probably seen right now, and we're not getting the opportunity to do so. A lot of us want to be heard right now, we're not getting the opportunity to do so. So I think if we can create, these platforms for people, so maybe somebody else will not be able to do it, but if you can create these series, that's one thing. The other thing is trying to do similar webinars, workshops, sessions around LGBTQ and mental health, safety, self-care, safe spaces and keeping well, what we're doing right now, because you don't know who will really need it. Okay, so we are a set of people right now who are having this conversation, but this will only help is once you actually start multiplying the entire thing. So you should get out of this call right now and probably think about what is it that you can do as an individual. So probably you could look at a similar webinar or a series where you could engage with either the allies or LGBTQ individuals, where you could speak about safety, you could speak about self-care. Yeah, these are two things of what I can think of at the moment.
For me, just a very kind of a useful tip maybe after tonight's session, or go back to your team and talk about your experience of sitting in and listening to this conversation we're having, and start that conversation by sharing about what you've learned and heard, and then see where it goes from there, depending on how big a group you want to start it with your colleagues and your team, and invite people's ideas as well. So start from what you learned from tonight and let it go from there.
Okay, another question is, if we see that one of our colleagues is in a burnout situation, what should we do, especially if that person is at the management level?
Okay. So I think if you are in a burnout situation right now, it is best to speak to a therapist. So I don't think either of us have mentioned this, but the first most important thing with burnout or any mental health condition or concern or issue is that we should reach out to a therapist. We generally ask ourselves this question as to when is the right time to speak to a mental health professional. And I think that when we're talking about mental health issues, it's like a spectrum. It does not mean that you have to go to somebody only when you're reaching that point of burnout or breakdown. But I think even if there are the not so difficult issues to deal with, is also when you can actually speak to a therapist. I think that would be the first thing to do. I think other than that, if you feel like this is not a moment where therapy is accessible, you cannot you cannot do it for various reasons. I think it's just important to understand what you are going through, what you're feeling, to just reflect over your emotions. It could be a lot of it could be tiredness, fatigue, your sleep patterns would have been changed. So just going back to what we were saying earlier, those are some of the techniques that you could use, whether it's maintaining a routine, finding other things that you could do during this moment to feel a little better. So for me, cooking is very therapeutic. I love to cook. And when I feel like, okay, things are getting very difficult to manage, I will cook. Or, a lot of times organizing and decluttering helps. So when I'm saying organizing and decluttering, I would probably just go to my cupboard and remove all the clothes and start putting them in one by one. So that really helps to declutter my mind. So these are different ways of how you can cope with it at the moment. If it's for a long-term plan, then I think speaking to a therapist would be a good idea.
I just want to highlight the point about, I think the question came from somebody, if I remember correctly, the question came from somebody who's worried that their manager may be experiencing burnout. I'm mindful that maybe the relationship with the person may be a consideration, so I would urge bit of discretion, I suppose, because depending on what the power dynamic or the relationship between yourself and the person you're concerned about, in this case, it may be a manager. Being a manager myself, I know I can be a bit cautious or defensive if one of my staff were to check in on my mental health. So my top tip for you would be find the right time. And also find the right time, find the right way to introduce the topic as well, because you also don't want your manager to be wondering why you bring this up. So again, back to the idea of, maybe use this presentation as an entry point, just kind of what I call, it's a very Singaporean thing, the by the way kind of a conversation starter. Oh, by the way, just the other day, I attended this webinar on self-care, and one of the presenters were talking about burnout and compassion fatigue, and then da-da-da-da-da-da. Kind of a softly approach to it. So, I mean, that's the tip I can share with you, if that helps.
Okay,
if I may just add something to that. Hello?
Yes, Kalhari, yes, please go ahead.
Yeah, very quickly. I was listening intently to our speakers, very eloquent. I would say that do not wait until you are burnt out. I know this is about a manager. What we are trying to do in the UN is to get people to talk to counselors, because there's a huge stigma surrounding mental health, our professions. And just to get someone to talk to us, you don't have to wait until you are burnt out or you notice that somebody is burnt out. So what we are trying to, there's a whole series of webinars that we are planning on the UN intranet that you can be part of on UNIC. Most of you, I think all of you can access that. In relation to destigmatizing the mental health services, whether it's related to the LGBTIQ plus community or our UN community in general. So I would say having a chat, do it the Argentinian way. Very quickly, I want to tell you about Argentina. I don't know whether any one of you is from Argentina. I'm sure maybe there are few. We take this example that you may have heard that per capita, the largest number of psychologists and therapists and social workers in the world is in Argentina. You can Google and find that out. So what they do is they have this habit of going to the therapist for a coffee. Okay? So you can read about it. I'm sure you've heard about it. Richa and Yangfu as well. So what we are trying to do, we are very far from that in the UN, that where, people will come to us with a coffee and let's have a chat. But I would like to invite all of you to start doing that. And this is the perfect time to do that because, we are by ourselves, and whether we live with partners or not, it's a good time to take care of yourself. And the speakers today spoke very well about it. So to be mindful of ourselves. So one of the ways in which you could be mindful, look after yourself, is to reach out to a counselor, not because you have something to talk, but do it the Argentinian way. I'm just using that example. Just, call us up, say, I just want to have a chat. I just did that recently because I'm overworked. I waited. I didn't take my own advice. I waited. I'm overworked. I was about to be burnt out. So I talked to a colleague of mine and I just managed to get out of it. But I'm saying don't wait until like I did. So just want to tell you that the counselors are there also for you to reach out and have a chat. So please don't wait until you have reached that point or you see a colleague reaching that point. Okay, just wanted to give you that that information. Thank you.
And just very quickly, I've just typed out in the chat bubble panel some examples of check-in questions that you can ask, hopefully in any setting, very informal, the very Argentinian coffee kind of a chat, what I call informal check-in questions.
Thank you.
Okay.
And thank you, Kalhari. I just want to clarify for maybe those on the webinar who don't know that iSeek is the UN's intranet that the Secretariat staff have access to. Kalhari, actually, the last two questions are for you, although the other panelists are welcome to comment on them. The first one is, how can you address your supervisors who are not creating a safe space at work for LGBTIQ+ colleagues, including yourself, in a way that doesn't expose yourself too much if you're not open at work? And I know this is a huge concern for UN staff members around the world in all of the agencies and in the peacekeeping operations, that the office is not a safe space for LGBTIQ colleagues, and that it's difficult to broach with supervisors and managers who are maybe not open. So what advice would you have to give?
That's a great question. Thank you for asking that. In fact, it is a question that we are grappling with as counselors as well. We do get questions like that from our colleagues. You know, how do you talk to an insensitive manager? A manager can be insensitive to many things. Now, there is no perfect way to address this, but I can tell you with the experience that we have in SISMO, one of the ways in which you can do it is to first have a little, choose somebody in your team that you could talk to about this before you approach the manager. Let's say you are in a small team, there may be somebody who you get on well with and knows your situation, and you have a rapport with the person. I'm not talking about just professional rapport, but personal rapport. And try it out with this person. How do I approach the manager? How do we approach the manager? Often what we have seen is, this is if you have somebody in the team. There are various scenarios. If you don't have somebody that you trust in the team, it would be difficult. But if I take this example, and this has happened with the LGBTIQ community as well as other communities, right? So what happens is you model your plan on the peer, and then the peer can give you feedback, and then both of you can approach the manager rather than going yourself, and it has worked. For example, you going there by yourself, it's threatening to you as well as, if the manager is insensitive, it's a dead end. So what we have seen working for people who can find a peer in a team is that the peer may not be from the LGBTIQ+ community. And that works well because then you have a safe, a kind of a peer who could also take your cause to the manager, and having two people talk to the manager is easier to even if the manager is very rigid and insensitive. So that's one tip I can tell you. But of course, there are many tips I can give you dependent on your situation, and I'm happy to talk to anybody after this session if you feel that you have a specific concern that you need to address a very rigid, very insensitive manager. I'm sorry to tell you that many managers are like that, and there are a lot of good managers as well. But as I think Richa and Yang first talked about, having educational sessions, psychoeducation, and we can do that for you, by the way. If you request, we can make a full iSeek session on this. We are talking about managers. We are talking about other issues if you have been listening to the iSeek sessions. So that's one tip I can give you, but please reach out to me. I can talk to you about your personal situation and give you some very good tips.
Great, thank you. And the last question that we have is related to this. So if someone is in, let's say, a precarious situation in their duty station at the moment, and so I'll give an example of that. We, in the last webinar, had someone ask a question which I think is representative of many of our trans staff who are in the field right now. They were worried that if they have to seek medical care, they could be outed in the process, and they felt that that would be extremely dangerous for them. So what if someone is in a precarious situation and they do not feel comfortable reaching out to their office and they don't feel safe reaching out to UNDSS? Because that's often our default recommendation, right? Reach out to UNDSS. But what if they don't feel comfortable reaching out to the security officer? What other avenues do they have through the UN system that you can recommend?
Thank you. That is also a great question, but can you be a bit more descriptive? Is it related to a medical concern or just in general safety concern?
It could be a safety concern, it could be a domestic concern, it could be a medical concern, just something fit them to get assistance from their office agency, from the UN in relation to that, but they don't feel safe having to share their status.
Right. I mean, I need to clarify something here. When I know this question came up, you know, when you say UNDSS, it doesn't mean the security officer. You know, every duty station has a security advisor, right? And they are not mental health professionals. And in many duty stations, in the 15 missions we have counselors, except in Kashmir, you know, Pakistan and India, Kashmir, that particular mission. You can directly speak to the counselor. You don't need to go through anybody. This is the only way, right? And of course, if you can't trust your counselor, that is why I gave you all these names, the SISMU contacts. You can directly write to us or give us a call or send a text message. But usually the counselors are trained to be non-judgmental, okay? You know, I cannot vouch for everybody's the professionalism, but I can tell you that that would be your safest bet, to talk to the counselor that I am about your safety issue, whether it's medical, whether it's concern about a partner, concern about the office, because we are trained to do that. We are our group is the 99% of us are clinical psychologists, counseling psychologists, and former psychiatrists. And we call ourselves counselors because that's the label we have in the UN. So please reach out to us, and we will help you. We will help you, and I can assure you that people are reaching out. People from the LGBTIQ community are reaching out, and we do help. So please don't feel alone, because we are all there for each other. We have only each other, remember that. So whatever the safety issue, please reach out to your mission counselor, to the station counselor, or to us if you don't want to speak to them. But if it's an emergency, definitely you will need to contact the closest counselor. You don't have to talk to the security advisor. No, we will discuss with you who you need to contact, and we will give you the safest option. We will try to help you. So please know that there is support available. And it would be also good to have a rapport with any counselor in your duty station or outside in anticipation, as part of being mindful, being prepared for any emergency. So if you have a rapport before, it would be easier for you to reach out if you have a particular concern. So I highly recommend you to connect with your counselors without waiting for any eventuality. But please do reach out to the mental health professional.
Okay, great. Thank you. That's excellent advice. That's it for our questions. We did have a number of participants who asked about the recordings. We sent out the last recording from the first webinar in this series through email to everyone who registered. We will also post it on the UN Globe website along with this recording, and we will send an email to all of the participants with the full recording. You're welcome to share it widely with staff in your agencies, and we thank you for doing that. And with that, I'll pass the ball back to Nanu.
Okay, thank you, Jen. Thank you very much, and thank you for sharing that reminder. Yankwa, Richa, Kahari, I can only say a big thank you on behalf of UN Globe, its board, its members, the coordinators. Thank you so much. Yankwa and Richa, particularly you have donated your time kindly to us. But I know UN Globe doesn't have the funds to compensate you for your time, or so we're very, very sorry. But thank you again for sharing your wisdom, your experience. It's very, very useful that we know that we have community that we can turn to and count on. So thank you very much. To all our members who are listening right now, basically to all our members, you do feel free to reach out to us as well, to UN Globe, and send us an email at unglobe@unglobe.org. If you have any questions or concerns, we'll be happy to, if we can't help you directly, we're happy to support you and point you in the right direction to who you can speak to. As I said, the UN Globe is a completely voluntary organization, and we have just set up a new payment scheme through PayPal. So sharing the link with you. So we rely on your contributions to help us with our programming and support. So any amount, please consider making any contribution to UN Globe through our PayPal account. Again, thank you very much for Richa, Yangfa, and Kalahari. And that's over from us. So thank you. Goodbye.
Thank you for having us. Thank you.
Thank you. Goodbye.
Bye.
Thank you, everyone.
Oh, I did forget to say a big thank you to IOM and to the board, Gabe Skelter, to Sonia Donnelly, to Sophie Brown, Jenny Back, for working with me on these webinars. So thank you. Bye-bye.
Thanks, Nanu. Bye.
Thank you. Bye.